Hello and welcome. Welcome to Caregiver Action Network's webinar for family caregivers. I'm John Schall, the Chief Executive Officer of Caregiver Action Network here in Washington, D.C. Let me give you some information before we get started. Today's session will last approximately 1 hour. Please note that your cameras and your microphones have been turned off from this end, so we cannot see or hear you. Nonetheless, we want you to be able to ask us questions. So to make a comment or ask a question, go to the chat function on the right-hand part of your screen. You'll find the chat bar and type in your comment or question. We'll have some time at the end of the presentation for questions and answers. But if we don't get to your question, don't worry. We will be emailing responses after the session ends. During the course of the session, we'll also be using some interactive polls of questions that we'll need you to answer. These really help us refine these training sessions as we go forward. And you'll find the polls also in the polls tab on the right-hand side of your screen. We will also have 2 surveys, one at the beginning of the session right now, and one at the end that we'll need you to fill out for us. And you'll hear more about that in a minute. And those surveys can be found on the Offers tab on the right-hand side of your screen. Let me take a minute and introduce 2 members of CAN's team who you'll be hearing about during the course of this hour's session. Chance Browning is our Senior Director of Programs, and Nicole Goebel is CAN's Program Coordinator. I want to give them both a chance to briefly say hello. Chance?
Hi, everyone. Looking forward to this discussion today. Senior Director of Programs here. Excited to be joining today.
Thank you, Chance. And Nicole, do you want to give us an opportunity to say hello?
Hi, everyone, and welcome to this presentation. We're super excited to have you here. I'm Nicole and the Program Coordinator.
Thank you so much, Nicole. Chance and Nicole have been presenting these training sessions in person and virtually across the country from coast to coast, from New York to California, from Chicago to New Orleans. These training sessions are a key part of CAN's nonprofit mission to empower and support the nation's 90 million family caregivers. We provide resources, tools, and trainings like this one, so family caregivers like you can feel more equipped to handle their challenging roles. We know that family caregivers who feel better prepared and supported in their role are much less stressed as family caregivers. We have a lot of you with us across the country, the webinar today. It's a lot of people, but we'll make this work as best we can. We are here today because of the support of our partners. First, I want to say American Bone Health. A thank you to them, who is actually our host for the webinar today. We are so proud to partner with American Bone Health, who really is a national leader in this field. I want to give a minute to Lisa Qualls from American Bone Health to be able to introduce herself and American Bone Health as an organization, and to thank her for hosting us today. Lisa?
Thank you so much. I'm Lisa Qualls, the Director of Partner Relations for American Bone Health, and we are so happy to work with Caregiver Action Network on this program to help you all understand how you can best care for your loved ones with any kind of condition, especially osteoporosis or bone conditions. So American Bone Health, we are a national nonprofit, and we work with communities across the country. We empower, educate, and engage people in communities to help them understand how they can improve their bone health and build strong bones for life and live a long, independent life. We have lots of tools and resources on our website, and we invite you to take a look. So listen, and we'll see you at the end. Thanks.
Thank you so much, Lisa, and thank you for hosting the webinar for us today. Our other partner is Amgen, and I want to say a special thank you to Amgen. They sponsor a lot of our training sessions, but I'm particularly happy with them sponsoring today's session because of the importance that Amgen puts on the issue of osteoporosis and bone health generally. For me, this is of particular personal importance. My mother has osteoporosis. She's 89 years old. She's had, I don't know, any number of broken bones from head to toe over the last few years. And in fact, just in the last few weeks, has recovered from fracturing her ankle. Just goes to show how important bone health is for all of us. So thank you for Amgen for being a part of this. As I mentioned, today's webinar will take approximately 1 hour. The 1 hour will be divided into 4 modules of the information that we're going to present with you today. And right now, to kick it off with the first of those modules, I'm going to turn it over to Chance Browning. Chance?
Thanks so much, John. Yeah, we're excited to dig into some of this content today. First, we want to start by tackling some of the tools and resources that are available to family caregivers all across the country. Then John will come back and talk to you a little bit about patient and family-centered goals, what those are, how you can establish them, and how it will be beneficial. Then we will talk about researching treatment options. All of these tools today are designed for any condition or disease that your loved one may have, and they're designed to be applied to any of those conditions. Today we'll be exploring it through the lens of osteoporosis and bone health, but again, this content is really designed to be adapted to all family caregivers' circumstances. And then John will come back and wrap things up by talking about shared decision-making and how some of these concepts all tied together. As John mentioned earlier, make sure you're using the chat function on the right-hand side of your screen to post any questions that you may have. We have some time set aside at the end to address some of those. And any questions we don't have a chance to answer, we will certainly follow up via email. So to kick things off today, on the right-hand side of your screen in the Offers tab, you will see our pre-survey. So as John mentioned, there's a survey at the beginning and a survey at the end that we really want to use as a way to assess how impactful and successful some of these presentations are. So I'm going to give you a quick minute to click on the Offers tab and fill that out. We want to make sure that you have the pre and post survey completed in order for you to get the Target gift card that we're offering for those first 100 who registered and attended today. So I'm going to mute myself here for a second, let you complete those offers or complete the survey in the Offer tab, and then we'll get started with the content. So while you are still finishing that up, I just want to emphasize at Caregiver Action Network, we understand that your time as a family caregiver is extremely valuable. And so, part of us in offering this gift card is to help you in whatever way we can. So, as I said, I know folks may still be logging on. We want you to make sure you complete that pre-survey and that post-survey in the Offer tab on the right-hand side of your screen. We'll go ahead and start digging into a little bit more of the information at this point. You'll be receiving an email from Caregiver Action Network following today's presentation with a whole host of links and attachments to all of the resources that we're talking about today. One of those that you'll receive is an opportunity for you to share your story as a caregiver. You see on screen today, Candy from Florida. She's one of the stories that we've collected across, as Nicole and I have traveled cross country presenting the same content. We capture our stories, we capture these stories on an app within our smartphone. So we'll be sending you a link as well so that you have the opportunity to share your story as well. These are especially important for us when we do work such as advocacy on the Hill, or when we're talking to the media, or when we're doing presentations like this very one today. And so as you may have seen on the first pre-survey, there was a question at the end that asked you how you felt the first time you realized you were a caregiver. And for myself, it was overwhelming and devastating and confusing all at the same time. What you see on your screen right now is really a word cloud, because we've asked that same question to thousands of family caregivers all across the country. And so the larger words you see on the screen means that those are the words that more commonly or most commonly we hear. And so, being a caregiver can be an isolating experience, but it's important to understand that, you're not alone in this. And the more you can connect with other family caregivers, be that, a support group, be that an online group, friends and family, the more you can find someone to talk through some of that, it really does help. Feelings aren't right or wrong, they just are, but it's important to know that others are going through that same experience as you are. So after today, we want you to leave feeling confident and supported. Here at CAN, that's the work we do, providing you with tools and resources and training opportunities. And so we really hope that that is the goal of today. So as John talked about earlier, we're starting out talking about the tools and resources. We'll build on that to talk about patient and family-centered goals, how to think about treatment options, and then tie this all together with shared decision-making. Now, at the beginning of each of these sections, we're going to be asking each of you a question. As John talked about earlier, we're partnered with American Bone Health, and we're really exploring some of these concepts through the lens of osteoporosis and bone health. So on the right-hand side of your screen, you will see a poll or a poll option. So within each of these 4 modules, we will be asking you to answer a question in somewhat real time. So this first question is about, developing a bone health plan starts with knowing your fracture risk. Has your loved one had a DEXA bone density test? This is the one where they lay on the table. Yes, no, I don't know. There's no right or wrong answer. It's just a good opportunity for us to take this this assessment. So also important to note is most insurances cover this assessment every 2 years for women over the age of 65 and men over the age of 70, when the risk of falls and broken bones often increases. So important information that you want to keep in mind about that. As we move into talking about tools, there really are going to be 2 key pieces that we highlight today, one being the patient file checklist and one being the medication list. And these 2 are really designed to work hand in glove. We will offer templates for this at the end of today's webinar for you to download, and we'll also be emailing you links where you can access these as well. What's important to keep in mind here is, you need to figure out how these work best for you. These are certainly a guideline for a best practice, but whether you are printing these off and putting these in a binder, whether you are filling these out digitally and uploading to something like Google Drive or Dropbox, or whether you're using an app on your phone. There's a whole host of different apps that you can integrate the same information into. And I'm actually going to bring Nicole back on screen because she's had some unique experiences in handling her own health records using an app. And we wanted to give her the opportunity to talk a little bit about that, particularly as it relates to some of the travel and work that she's done. Nicole?
Hi, Chance, and thank you. Yeah, I'm happy to talk a little bit about my own experience in using a tool to help manage all of my information. I have been using apps as kind of my main method of keeping all of this organization that we're going to be talking, all of this information that we are going to be talking through organized. And there's a lot of different apps that you can use. The app that I use is called Backpack Health, but there's a lot that you can kind of pick and choose from, and ones that are going to be kind of tailored to maybe a little bit more of what you need. How I've used it is, as Chance has said, I've traveled a bit. And the first time that I used it, I was actually traveling with him to give this presentation. And I had just had open heart surgery, was on new medications, and was worried, if something happens to me while I'm away from my doctors and away from home, what am I going to do? And so the app allowed me to pick what information I wanted to share with him, so that if something did happen, he would have the information about what kind of medication I was on, so that he could help in an emergency situation. The other time that I used it was kind of right after that. I traveled abroad and was in a country where English was not the primary language. The app that I use allows for language translation. So I was able to, I ended up in the ER and was able to use the app to share information with the physician that was treating me in a language that he could understand. Again, there's a lot of different tools out there that are, just kind of tailored to maybe specific things that you may use them for.
Perfect. Thanks for sharing that, Nicole. And, to her point, this is all about figuring out what works best for you in your circumstance. Maybe that's a printed version, maybe that's an app. But what we really want to talk today in digging into what a patient file is really, it's that central place that you can organize all of your information. It not only includes your medical records, but any research that you may have done and any questions that you may want to ask your doctor about at upcoming doctor's appointments. So when we think about what all we want to include in that, first you want to look at your medical records, and whether you're dealing with a binder with printouts or electronic versions of your medical records, or whether it's an app that you are syncing your medical records with. These are all options, but as you think about moving between specialists and your primary care physician and perhaps therapists, it's important to have these accessible and readily available. Similarly, you want to make sure you have all of your insurance information in one place. With caring for my mother, maybe it's me taking her to the doctor, maybe it's my sister, but either way, we want to make sure that we have that information in a place that we can both access. So, whether that's in the binder or electronically. We'll touch on medication lists a bit further, but know that this is an important piece to the patient file, but we'll actually dig into that here in a second. One other piece to think about including here are your legal documents. Specifically, if you're talking about a living will or a do not resuscitate order, it's important that you have those readily available. A friend of mine was in an unfortunate situation where she took her mother to the emergency room, and the doctor comes out and asks, does your mother have a DNR or a living will? And, my friend was like, yes, she does. It's in the car in my glove box. Can I run out and get it? And the doctor said, you can, but it's unfortunately, I need that immediately so that we can know which actions to take. So, having this information at your fingertips can be really important in emergency situations. So however you decide to organize these, it's just an important piece to keep in mind. here's a screenshot of what that patient file checklist looks like that we will share with you at the end of the presentation. Again, it'll be available for download, and also it'll be emailed out to you following today's webinar. In digging a little bit more into the medication list, this really is a crucial part of the patient file. You may keep this as a separate piece, but it's really important to think of this in a comprehensive way. And so what are we talking about when we say medication list? This includes everything from your prescriptions to over-the-counter medicines to supplements, vitamins, things of that nature. But it also includes things like, injections or patches or things of that nature. So in addition to having a list of what those medications are that you're taking, you also want to think about how that dosage may have changed over time, any reactions that may have occurred, in taking that, and really keep that readily available. As we were talking about earlier, in going in between doctors, it's important that they know what other doctors may be prescribing, particularly if folks are outside of, the hospital system or in another network. This is a quick shot of what that medication list will look like. Again, it'll be available for download at the end, and we will share that in the email following today's webinar. We will also be including a few other resources that are particularly helpful. One that is a doctor's visit checklist, as well as a video on how to talk to your doctor, in addition to a wonderful resource that American Bone Health has provided for how to talk to your doctor about bone health. What's important to note here is that typical doctor's appointments are 15 minutes in length. So preparing for those doctor's visits and having that information from your patient file readily available really helps to ensure that you are maximizing that time with your medical professional. We'll also be sharing with you some checklists on things to have on standby in the instances of an ER visit. So what's important there, we talk about having a go bag ready. Obviously, your patient file would be part of that, but we will be sharing that resource with you following today's webinar as well. The other important piece that we'll share is how to effectively report symptoms. In today's day and age with WebMD and Google, it's easy to start self-diagnosing, but you really want to make sure that you are reporting the symptoms as is and allowing the medical professionals to do their job. One other tool that we will talk about here is Caregiver Help Desk, which is an on-demand service that is available 8 a.m. to 7 p.m., completely free for family caregivers all across the country. The 800 number you see on your screen. It's also a chat widget on our website. So if you go to caregiveraction.org, you can actually chat with our caregiving experts, and they will meet you where you are and help you understand what resources may be available in your community. At this point, I'm going to hand it back over to John, who I know has another poll for you guys, and we'll dig into patient and family-centered goals. John?
Great, thank you, Chance. And for all of those who were with us today for the webinar, if you were not able to memorize all that important information that Chance just gave to us, don't worry. We'll be making it available to you at the end of the session, and we'll be following up with emails to you afterwards as well. So don't feel like you needed to memorize all of that important stuff. We now want to move on to the second module of patient and family-centered goals. And as always, with each of these modules, we start off with a poll question that we would like to have you answer for us. So again, if you can go to the polls on the right-hand side of your screen, under polls, you will find this poll question. Have you, your loved one, or their healthcare provider identified strategies to help your loved one achieve their bone health goals? Yes, no, I don't know. So thank you for going ahead to that poll and filling out that question for us. As I said, we are emphasizing bone health and osteoporosis in today's session. Chance mentioned the bone density exam in the previous module. I will say that last week, my sister, 66 years old, she retired in March. Last week was her 66th birthday, and she celebrated her birthday by getting her first bone density exam on her birthday, covered by Medicare, I'll mention. So we just want to emphasize the importance of bone health and getting bone density exams. What are patient-centered goals, right? Now we're going to talk about patient and family-centered goals, but really what do we mean by it? So a patient-centered goal is what the patient, that is your loved one, has prioritized for their care. And let me give you an example. 9 years ago, my mom had a stroke. She was 80 years old at the time. And I'll never forget the next morning in the hospital. I flew up from from Washington to Michigan to be with her. And the next morning in the hospital, the doctor came to my mom and said, "So you've had a stroke. What is it now that you want to accomplish? What is your goal?" And my mother said, without stopping for even a second to think about it, she said, "Well, I just have to have a complete recovery because I have to get home and take care of my husband." My mom was the family caregiver for my dad, who was 13 years older than she was. And the doctor said to my mom, "Well, having a clear goal is half the battle. And because you are so clear in your goals, you are well on your way to achieving what you need to achieve." So a good example there of the patient having a goal that they could articulate to the doctor, and very importantly, that the doctor asked for what the patient's goal was. You would think it's common sense, but you'd be surprised how common it really is not. So think of it this way with a patient-centered goals. You're really trying to elicit what your loved one's wishes and priorities are. And in doing that, you also want to think about the feasibility of doing this as a family member in terms of support for them. For instance, right now, everybody wants to age in place. Especially now with COVID running rampant in nursing homes, people want to stay home as long as they can. But with osteoporosis, that gives you some things you need to think about. If they're going to stay in their home, is someone available to move that person if they have pretty severe osteoporosis? Have you evaluated the home environment for fall prevention? And I want to stress this prevention point because when we're talking about bone health, preventive care is every bit as important as treatments and therapies. But as I said, this is really about patient and family-centered goals. So that's the patient goal. But really what happens here is that there are 3 different voices that are talking about outcomes. Your loved one, who's the patient, the medical team, that is the doctor and the other healthcare professionals that are providing the care for your loved one, but very importantly, you and other family members. What's important here is that you realize that you are a vital part of the healthcare team, and your input matters tremendously in making sure we get good health outcomes for your loved one. You are absolutely crucial in advocating for your loved one's wishes once they figured out what their patient goals are. This is especially true in cases if you're caring for a loved one with dementia or mental illness. You really see how you have to be their advocate. And part of being an advocate means that communication is key. You, as the family caregiver, really become the central point of communication. And it's your responsibility, one of your important roles, to keep the entire team on the same page. Well, why do we want to do this? Well, there are genuine benefits of creating patient and family-centered goals. First of all, it does decrease anxiety. And this is truly important, as all family caregivers, like all of us on the phone, know, that this is a really stressful situation. It's also important because once your loved one is invested in the treatment plan that has been formulated, because it reflects their goals, they are much more likely to stick with it. And we know that patients who stick with the treatment plan have much better healthcare outcomes. This is particularly true when it comes to osteoporosis, because it's critical to have follow-through on fracture prevention strategies. Well, now that we have figured out these patient and family-centered goals, how do we make sure we get the benefits of them? Well, the answer is communicate, communicate, communicate. Constant and open communication with all members of the care team. And most of that communication centrally will come from you as the family caregiver. So don't be shy. You participate in the doctor's visits with your loved one, the meetings, etc., so that you have all the info that you need to have so you can communicate about the patient's goals and the family-centered goals with those healthcare professionals, and then be able to communicate that to other family members and friends on the outside who are part of the healthcare team. So communication is the key to realizing the benefits of family-centered goals. With that, we're going to turn it to the third module, the third of our 4th modules in today's webinar, which is how to think about treatment options. And for that, I'm going to turn it back to Chance.
Awesome. Thanks, John. Before we dig into, how we think about treatment options, we have another poll for you. This again is connected to bone health and osteoporosis. So make sure you click on the poll tab on the right-hand side of your screen. For this one, where would you go first to find information about treatment or fracture prevention strategies following a diagnosis of osteoporosis or low bone density? Would that be a healthcare provider, friends or family? Would you search online? Would it be a disease-specific advocacy org like American Bone Health? Would it be something else? Or if you don't know, that's an option too. So take a quick second to answer that, and we will dig into how we think about these treatment options. So when we think about something like this, we often talk about comparative effectiveness research. And I know that sounds overwhelming and confusing maybe. I know it did for me the first time I read that. But this is really a strategy that you are likely already deploying in your own life. This can be something that you are doing when you're researching a new phone to buy, or buying a new car, or even like figuring out what restaurant you want to go to. Really considering all the different ways that you can research, whether you're reading online reviews or asking friends. It really is important that you consider all of the treatment options and choices that are available for your loved one and you and the family as well. So when we think about researching treatment options, there really are 4 main categories of information. Often case, the doctor may be your primary source of information as to what treatments are available. That's often where you're going to be figuring out your diagnosis or prognosis. You'll likely want to see about connecting with others who have been in that same similar situation. That often manifests itself through support groups, whether in person or online. Obviously, with COVID, far more folks are engaging online. And that sort of begins to connect you to other online research. Now, with the WebMDs and anything that you can possibly Google, it's important to keep all of that into perspective. With online research in particular, it's easy to go down a rabbit hole of what may be occurring in other countries in terms of treatment options. So it's important to check whether or not the treatment you're looking at is FDA approved or not. And then friends and family are going to be another piece of all of this. Inevitably, your cousins, sisters, best friend may have been in this same situation. So the friends and family are also going to have perspective and some of those firsthand experiences that will be important to put into perspective. So for today's diagnosis, we talked about this earlier. We really are looking at this through the lens of low bone density and osteoporosis. These concepts are all designed to be applied to any disease or condition that your loved one may have. And so, by looking at this with a specific disease, it sometimes is more helpful to understand what some of these steps really translate and look like. And so with osteoporosis, and with most conditions, there are really sort of 5 areas of focus. Depending on your loved one's condition, these may be in a completely different order, but because we're looking at this in terms of osteoporosis today, we're first going to talk about lifestyle changes and remedies. We'll cover medications, clinical trials, new treatments, and then possible surgical procedures in instances of broken bones. Now, I'm going to ask John and Nicole to rejoin me because we're going to talk through some of the pros and cons that can appear in each of these options. Of course, there are going to be pros and cons with anything. So let's first talk a little bit about some of these lifestyle changes and remedies. So in the case of osteoporosis, we're talking about quitting smoking, limiting alcohol intake, diet and exercise, of course, and then, vitamin or calcium supplements. So Nicole, when we're talking about pros, what really stands out to you in terms of pros for lifestyle changes and remedies?
Well, the pros fall into kind of 2 different categories. Peer that you consult may say a pro is that a change in diet and exercise can help prevent bone loss and fractures. And, in going online and Googling, you can find that it's generally pretty inexpensive.
Great. John, we'll let you be the bad cop today. So what are the cons?
Well, no mystery to anybody. Lifestyle changes are very tough. It's very tough for anybody to stick with them. You're trying to quit smoking or reduce your alcohol, whatever. So it's important as a family member that, not only you're being supportive, but that you're really not sabotaging their goals in some unintentional ways when you're not really thinking about it. So it really takes a conscious effort on the part of family members to make sure they're being supportive and not being sabotaging.
That's a really great point. As we move on to option 2 and think about medications as treatments, there's a wide range of medication treatment for osteoporosis. This includes the vitamins and nutritional supplements, but can also be, hormone replacement therapy and other prescription drugs. Nicole, what stands out to you as one of the pros here?
A pro would be that it can help minimize future risk by improving the bone density and strengthening those bones, which can result in fewer fractures down the line.
Great point. John, a con that stands out?
But with any medication, there's always the possibility that it has possible interactions with other medications that your loved one may be taking. A lot of people have more than one condition. Osteoporosis is, often something that someone has, but with other conditions as well. So you got to make sure that the medication doesn't interact or interfere with medications for other conditions. And if so, sometimes you have to decide which one you'll be taking.
Great point. So as we look at option 3, which in this case is clinical trials, or clinical research, as you may have heard it referred to, it really is the study where volunteers test new drugs and medical devices, procedures, medication. Nicole, what stands out as an obvious pro to you in this case?
Well, an obvious pro is that it can, participating in these clinical trials can be really effective and have amazing results. And another pro is that participants are often given a stipend or have some kind of compensation for their participation.
That's a really good point. John, a con that comes to mind?
Well, clinical trials are great, but they just may not be available or conveniently available. If the clinical trial is only available at some medical center 30 miles away from you, and that's the closest site, it doesn't necessarily become all that practical. So you have to see in terms of distance and those kinds of issues, how much it really is feasible to participate in the clinical trial.
Right. Great point. So option 4, we outline as new treatments. So in this instance, we're talking about newly approved drugs or procedures that may not be as widely known about. Nicole, on the pros, what would you highlight?
The new medications can be amazingly effective, and can be transformative in terms of your loved one's care.
Great point. John, any cons?
Well, the only con really is that it takes time for people to know about them. So if you're looking online, you may not see any information about new treatments that are available. And oftentimes, even your doctor may not know yet. That's just what happens because medical science is just changing so fast. Thank God it is. So don't be afraid to ask, and let your doctor figure out whether there are new treatments available. Just don't rely on your own research or hoping that everybody already knows about them when they're coming on down the line.
Smart. And so the option 5 that we highlight here, and as I said earlier, depending on what your loved one's condition may be, this may be option 1 because your loved one has had a heart attack or is dealing with cancer or something like this. But in the instance of osteoporosis, we'd be talking about this in relation to likely a fractured bone, a hip that may need to be repaired with metal screws and plates, and is often paired with some type of rehab or therapy. So in thinking about that, Nicole, what pro would you want to mention here?
A pro is that these surgeries and procedures are pretty common, and they have a very quick recovery time.
Great point. John, what con is worth mentioning here?
Well, when it comes to hip replacements, knee replacements, virtually everyone I've known who's had them has been thrilled with the outcomes. But, let's also be honest that caring for that person at home can be challenging as well. Right? When they come home from the hospital, they're not immediately up and around and walking. There are some challenges to caring for that person at home, and you can't be blind to that.
Right. Really great point. Thank you both for walking through that. I know at this point we've collected a lot of information, just like the little squirrel you see on the screen right now. I think it's important to, in doing any of this research, go back, update your patient file. You definitely want to have this information at the tips of your fingers when you get ready to go to your doctor next, so that you can, bounce some of these options off of them to really get their perspective, So at this point, I'm going to hand it back over to John, who will tie some of this together with the concept of shared decision-making. John?
Great. Thank you, Chance. So our 4th and final module in this training session is about shared decision-making, and we want to jump into that and then make sure we have a few minutes at the end for Chance to wrap this up for us and tell you what you need to know at the end of the session. As we do with each of the 4 modules, we have a poll question for you. So again, on the right-hand side of your screen, you'll find polls, and please answer this poll question for us. Who was the first person to realize that your loved one should have a bone health plan? Me, my loved one, their healthcare provider, friends or family? Nobody yet, unfortunately. I don't know, or other. And please answer that poll. These questions and answers are really helpful to us in refining where we go with these webinars in the future. So thank you for that. So we're going to talk now a couple of minutes about shared decision-making and what that includes and how the steps we've gone through before in the last 45 minutes of the session are important to reaching shared decision-making. Well, what is shared decision-making? Let's just start with that. Shared decision-making means making decisions on all aspects of care, whether that's the overall care plan, whether it's tests that may need to be administered to the patient, or treatments. And these are decisions that are made really between all of you, your loved one, and the healthcare team. Now, I talk about treatments, but when it comes to bone health and osteoporosis, prevention is every bit as critical as treatments, because prevention strategies, preventing fractures, is critical when we're talking about bone health. So in this case, shared decision-making can include having a regular conversation with the doctor to discuss a bone health plan as a regular topic of conversation in your sessions. So what is shared decision making? It's taking the goals that we talked about earlier with patient and family-centered goals, combining it with the research, the ways of finding out different options available that Chance just presented to us in the last module, and arriving at a decision that reflects your loved one's goals. What's important here is that both you and your loved one are involved throughout the process. And why is that so important? Because we know from healthcare research that the involvement of the patient and the family in preparing that treatment plan, in deciding what care will be coming from the doctor, makes successful implementation of the care plan much, much, much more likely. That's why following through on shared decision-making is so important to getting good healthcare outcomes. Now, there are a lot of key factors that go into making shared decision-making really work. You know, you have to think about, does the loved one's home allow for the particular treatment or therapy that we have decided to pursue? Again, this is important when we think about aging in place, because a lot of falls prevention and fracture prevention strategies come into play if the person's going to be at home. And you have to think about how feasible it is for us to provide the necessary support to make sure that that works. And then all the more importantly, to make sure that whatever treatment plan has been arrived at is aligned with the loved one's goals. It has to be aligned with the patient's goals. I emphasize that because, you know, as I said, there are really three parts, three players in this, and they all have different goals, right? Your loved one, the patient, has certain desired outcomes. You, as a family caregiver, may have certain desired outcomes for your loved one. And the doctor has goals themselves that they're trained to want to realize. What's important here is that these three views of goals of outcomes may not be the same. They can actually be quite different. And somehow shared decision-making process is putting those different desired outcomes together from those three parties to arrive at something that makes sense for the patient. So in going through that shared decision-making process, don't be afraid to ask questions. This is all about asking, and getting the information that you and your loved one to make the decision with the doctor about what treatment your loved one's going to get. And not just going in there and accepting what the doctor says and taking their treatment plan as it is without being able to give your input. Being able to give your input can make all the difference in the world. Remember, too, that you as the family caregiver are the ones who are going to see to it that decisions are made in the best case for you and your loved one. So now you've arrived at a shared decision, but now what? It's really critical that as you're there with the doctor, you really understand the details of what the care plan entail. And make sure your loved one is understanding the details of the care plan. You guys have been using the chat function quite a bit with some excellent questions and some excellent advice back and forth to each other, which I'm thrilled about. And one of the most interesting questions, and I think one of the best questions and advice this person got in response to their question is, you know, how do I make sure my loved one actually follows through on what they agreed to when we got into the doctor's office about that care plan? Well, one important way is to make sure they understood the details. The more they understood the details, the more likely they are to follow through. So to make sure your loved one is really understanding the details of that care plan, make sure they're actually saying it in that appointment with the doctor. Let your loved one, let the patient repeat back what those care plans really entail so they're really understanding them. And even then, you know, as we know, only about 18% of what the doctor said and we all agreed on that day will be remembered after the fact. So you're there as family caregiver to make sure that you can remember and help your loved one remember. So please make sure you're taking real detailed notes on what that treatment care plan is to help remind your loved one so in the weeks and months ahead, they can actually go along with the treatment care plan that they agreed to, and make sure you're keeping those records. So that kind of brings to a close the shared decision-making part of this. And I want to turn it back to Chance for our remaining minutes of the session to bring this all together and then to give you some important information that you need to know as we finish this up. Thank you. Chance, it's back to you.
Great. Thanks so much, John. As I said earlier, obviously we've been giving you a lot of information. We'll be sending a follow-up correspondence after today with links to all the resources that we're talking about so that you can review it again. You know, we started out today talking about the tools available to help you, from the organizational pieces of the patient file checklist to the medication list, to some of those, you know, more tailored questions that you may need to be answered, that, you know, by reaching out to Caregiver Help Desk, you really can get some of that one-on-one support. From there, John built to talk about establishing patient-centered goals and what and why those are important. We've talked about identifying and researching all of the treatment options available for your loved one. And then he tied it all together really nicely by underscoring why shared decision-making is so important. So we hope today you are leaving feeling a little more supported, a little more knowledgeable, because that really is our goal here at Caregiver Action Network. You know, we hope the information that we've provided you has put into context, you know, principles and ideas that can be applied to any of your loved one's disease states. And we hope that it's been especially helpful to think about things through, you know, the lens of osteoporosis and bone health. So before we wrap things up today, I want to take a minute. As I said, there is a post survey that is available at the end that we need everyone to complete. So within the offers tab on the right-hand side of your screen, if you can go there and complete the post survey. Once you're completed, you can X out of that box, and then we will have another form available for you to then click on within the offers tab to sign up for your e-gift card that we will be sending out. Again, these are for the first 100 who registered today and attended. And I'm going to pause here just for a quick moment for everyone to go through that and complete those. But I'm going to stop here for a few moments so that you can complete that survey. So I know you're all probably still wrapping up some of that survey. I just want to also remind you, once you've completed the post survey, you can X out of that window, go back to the offer tab, and the form to submit your information for the e-gift cards will then appear there. Like I said, at Caregiver Action Network, we understand a caregiver's time is valuable. And so we want to be able to help you however we can. And this is our small token of appreciation for joining us today. I also, as I bring back John and Nicole to talk about some of those questions that have come up in the chat box, I want to use this as a reminder to stay connected with Caregiver Action Network, be that our website, be that Caregiver Help Desk, the 800 number you see on your screen right now, or you can always email us with any questions to info@caregiveraction.org. Also encourage you to connect with us on Facebook and Twitter, as that's always a good way to find out the latest and greatest information.